Hello, good morning, guys. I'm that Pinoy nurse. Welcome to Nursing Informatics. In this presentation, we're going to be talking about a short introduction on nursing informatics. The goal is for you to have a basic idea what informatics is and why it is important. So let's begin. So computers have become a part of everyday life for many people, including nurses. Computers are used for educating nursing students and clients, assessing, documenting, and testing clients' health conditions, managing medical records, communicating among healthcare providers and with clients, and conducting nursing research. As you can see, education has developed beyond the four walls of classroom. Like what we are doing now, online classes and distant learning are made possible by technology and computers. In assessment, we have digital thermometers, BP apparatus that can check pulse rate. At the same time, uh, so making assessing the vital signs easy. And we have documenting clients' notes and doctors' orders. Laboratories can now be done on a computer where health practitioners can easily access and store data. With the use of CT scans, MRIs, and etc., testing clients' conditions are made easier. So we are now able to identify problems in the clients easily. So managing medical records, so storing records and managing them are made easy using computers and file folders compared to before in using the paper record that would require a ton of paper and a large storage facility. And as you can imagine, finding a document in a large facility with lots of folders would be difficult. Also, communicating with clients are made easy nowadays. We have online healthcare where the patient and doctor just chat, and the patient just sends picture of the chief complaint, and the doctor will give or provide instructions for the patient. Another good example, especially in the pandemic of COVID-19, where physical face-to-face communication is prohibited for client and their families. So, especially when they are dying, so what nurses or the health practitioners do, they use cell phones to make video call so that the patient and their loved ones can still communicate during the end stage of their treatment or their life. So conducting research is now made easier with computers. The ability to search various of informations, journals, and articles would aid in research very abundantly. So, making a research now, before you have to scan a lot of books, journals in the library to get your references or related literature. But now, most of the related literature are online and can be easily searched using the computer. All nurses must have basic level of computer literacy. So, computer literacy, the knowledge and ability to use computers or technology in order to perform their job. That is why you must be equipped and prepared to use computer and technology for the care of your patients. Informatics. Informatics is defined as the science of using computer information system. So, science, as you know it, is a body of knowledge. So, using the computer information system. So, system, as defined, is a set of methods that carry out a common goal. So, the common goal is to process this information. Health informatics is defined as the management of healthcare information using computers. So, the focus here is the management of healthcare information, a very specific type of information which is healthcare. Nursing informatics is defined as science of using computer information systems in the practice of nursing. So we have here, so informatics, the science of computer information system. So you use this informatics or you use this science for nursing practice. Okay, so basically, nursing informatics is the use of informatics in the care for patients. So, nursing informatics, according to American Nurses Association 2008, a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, and knowledge in nursing practice to support patient, nurses, and other providers in their decision making in all roles and settings. So, it is the combination of nursing, computer, and information for the purpose of providing optimum nursing care. A little bit of history. So we have here in nursing the Technology Informatics Guiding Education Reform or TIGER initiative began in 2006 to identify information or knowledge management best practice and effective technology capabilities for nurses. So here they are trying to identify the best information knowledge management practice that can help nurses. So the Tiger Initiative is designed or designing plans to enhance the nurses' ability to use electronic health records to improve healthcare delivery, have more nurses engaged in national healthcare information system infrastructure, speed the adoption of technology that can enhance healthcare safety and effectiveness. So, clinical alert. Nurses increasingly use smartphones or PDAs or personal digital assistants as calendar date books, address books, drug and disease database storage devices, and data entry and retrieval devices. So nowadays, nurses have phones, cell phones. Even you have mobile phones, which has common apps. So some apps are your reviewers for your report exam or NCLEX or your notes. We have the drug handbooks are now found in your phones, medical dictionaries, medical mnemonics also, and many more. So nurses now are increasingly using computers and technologies, especially cell phones, in the care of patients. So we have here the National e-health vision of the Philippines. So by 2020, e-health will enable widespread access to healthcare services, health information, and securely share and exchange patient information in support to a safer, quality healthcare, more equitable and responsive health system for all the Filipino people by transforming the way information is used to plan, manage, deliver, and monitor health services. So, in the Philippines, we have this vision that health information will be available for all. So, we have the page IE implementation or the Philippine Health Information Exchange implementation. Then it needs to be standardized. The health data need to be standardized. So we have electronic medical record certifications. Then the information technology in all public health facilities. So easy access for the information and information technology enabled health services. So allowing people from all around the nation with all walks of life to be able to gather or to be able to get this information. So we have here common computer related acronyms. So please take time to study them. We have the common ones here are the URL, Universal Resource Locator or the web address. It is the one that you copy paste when you are viewing YouTube or a video in your computers. We have www, World Wide Web, that's a common one. And then PDA, we have here personal digital assistants or your cell phones. Next, we have computer terminologies. So most of which are already common, especially in your generation. We have apps, blogs, weblog, we have Twitter, widget, and wiki. Okay, so we have also your smartphone, mobile phone with computer-like capabilities such as email, internet access, audiovisual players, camera, and computer programs optimized for mobile use with application. So that's a smartphone. Okay, so take time to study these computer terminologies. Computers have significantly expanded access to information from around the globe for both healthcare team members and consumers. So nurses should evaluate health websites as they access them and assist clients in doing the same. So nowadays, so we can easily get a hold of a computer. We try to become doctors using computers, right? So we have an illness, we have a symptom, then we search Google what it is, and the common ending would be we have cancer. Okay, so you need to be able to identify, or you need to be able to evaluate the internet health information that you are looking at. So make sure that you're looking at a reliable internet information or health information, not just for you and especially for clients if you are planning to share this information. So first step in or the sample criteria in evaluating internet health information, we have author or sponsor. So ask who created and updated the site, are their credentials listed and appropriate. Next is the purpose. Is it clear whether the site is informational or commercial? So basically, if it is commercial, so it would probably be the best view of the topic because it is a commercial. So who is intended audience? Sometimes the website URL provides some of this information. For example, .gov is for government sites, .org for professional organization, .edu for educational institution, and .com for companies. So as you can see, the commonly used is .com for companies, right? Like Facebook.com, things like that. So as you can see in the school websites, we have .edu. Next is the recency. When was the information in the site last updated? So a current rule of thumb is always when you're looking an article or information, it must be at least 5 years old. So you have to check the information because there are updates and sometimes information in the internet are not updated. So you have to be updated. Check for the last updated time. Accuracy and sourcing. Where does the site get its information? Are factual statements cited? So this is also important to identify where the information is coming from. For example, Wikipedia is a platform or a website that can be edited by anyone. So even I can edit the Wikipedia, even you can edit Wikipedia. So make sure that when you are sourcing or you are referencing an article, you have a factual statement cited or you have a, a good author that provides the information. So you have to assess or evaluate this information. Computer system. So all networks of computers, users, programs, and procedures in an organization. The purpose is to assist the healthcare team with decision making and communication. So it is not only the computers, it is also the users, the programs, and procedures. So as you can see, so computer system is a group of computers, users, programs, and procedures interconnected. Okay, so we have two common types of computer system used by nurses. We have management information system and hospital information system. So we have number one, management information system or the MIS, designed to facilitate the structure and application of data used to manage an organization or department. So we have the structures of MIS, we have the software, database, procedure, operating, personnel, input and output, medium and message, and the hardware. So all of this are focused on management of organization and department. So the system provides analysis for strategic planning, decision making, and evaluation of management activities. So all level of management benefit from the ability to access accumulated data. So with this data, they can use it to plan their strategies, to make decisions, and to evaluate how they manage their organization. Next, we have number two, Hospital Information System, or the HIS. Is an MIS that focuses on the types of data needed to manage client care activities and healthcare organizations. So, the focus here is to manage client care and healthcare organizations. So, it becomes a hospital information system if it is only focused on the client care. So, subsystems in the areas of admissions, we have medical records, clinical laboratory, pharmacy, order entry, and finance. So here's an example of a hospital information system. We have the radiology department, pharmaceutical, operation theater, outpatient, nursing, inpatient, clinical, and laboratory. So these are the examples of hospital information system. So next, we have the Health Insurance Portability and Accountability Act of 1996, or the HIPAA, established legal requirements for the protection, security, and appropriate sharing of personal health information, referred to as PHI, or the Protected Health Information. So, this is one of the laws governing nursing informatics, which, with all the data that is provided and stored, especially with clients in the hospital setting, keeping this confidential and safe is one of its main priorities. So that is it for the short introduction of nursing informatics. I hope you've learned something. So I'm that Pinoy nurse. Stay interested. I'll see you on the next presentation. Thank you.